Hi, I'm Dr. Richard Patrononi, and in my practice I was having the same problems as most physicians were having with access, communication, really challenges managing certain disease states. And I knew that I needed some help in reestablishing that communication with my patients. We wanted to use some technology, and specifically the Hello Health platform is allowing us to reach those goals. It's allowing us to, number one, improve access, number two, improve communication, and number three, manage disease states more efficiently. Here's a few ways in which we're using the platform. So we all know that access to the physician is challenging. It's a problem in my practice, and it's a problem for many physicians. And we knew that we needed to increase that accessibility. The use of technology, and specifically the Hello Health platform, is actually allowing us to increase that accessibility. So our patients in our practice can now simply sign into their account. They can access the schedule module that will pull up my availability. They can simply pick a time, either a same or next day appointment. They can state the reason for their visit, and then they'll receive an email confirmation showing that a visit's been made. On the physician side, I can see that a new appointment's been scheduled and why my patient is coming in for care. Patients can simply then come to the office, receive their care, and access is as simple as that. Prescription refills for our patients we know is very challenging. It requires constant calls to the pharmacy, calls to our office. Messages are then sent to myself. I'll communicate back to my nurse. These calls go around and round and round, making prescription refills rather challenging for our patients. And we knew that this is something that we needed to fix. With the use of technology in our practice, we're now making prescription refills much easier. Patients can now simply log on to their account online, send an email directly to myself requesting the prescription refill. After receiving that email, I can access the patient's chart to determine if the refill is appropriate. If it is, I can go ahead and fax that prescription to the pharmacy. I will then send an email to the patient letting them know that the medication is ready, and then they can simply go to the pharmacy to pick that up. The communication is also now part of the patient's chart, and we've now made prescription refills amazingly easy. Another great way we're using technology in our practice is to manage medical issues for our patients. For example, my patients with high blood pressure, I normally see every 2 to 3 months, and there's a lot of time in between those visits where communication is lost. With technology, however, I'm able to connect with my patients more frequently. I can now be emailed. Patients can upload blood pressure readings that they get at home, their exercise regimens at home, and I can review this data online. Based on that information, I can make medical recommendations. I may need to schedule a patient to come in sooner, or we may be able to connect online through a video visit or instant message visit. It's this increased communication which is going to improve the outcomes for my patients.